Hi, my name is Megan. I'm a pharmacist from Chartwell Pharmacy, and today I'm here to talk to you about Adstiladrin therapy. Adstiladrin is a therapy that is instilled directly into your bladder to help treat bladder cancer. Instillation essentially means the medication is delivered through a catheter into your bladder to help directly kill the tumor cells that exist there. The way this drug works is it's actually a gene therapy that's carried by a non-infectious virus to those cancer or tumor cells to help kill them more effectively. The good thing about this is that it really only targets those cancer cells, so you have a decreased risk of having adverse events. The medication is administered via 75 mLs that is directly instilled or put through a urinary catheter into your bladder. You will have to hold on to those 75 mLs for approximately 1 hour. Your physician will have you rotate approximately every 15 minutes to make sure that therapy is coating the various aspects of your bladder and reaching the tumor cells. As long as your physician has identified that this medication is working for you, you will continue to utilize it every 3 months. It is important that you communicate to your physician and to your pharmacy should you have any symptoms of a UTI preceding the installation of this therapy. That can include symptoms such as frequency of urination, urinary urgency, or pain during urination. Additionally, if for some reason you are unable to maintain your appointment with your urologist for the Adstiladrin, you need to notify your physician and the pharmacy as soon as you're aware of that. Adstiladrin is generally well tolerated, but you can have some local symptoms or side effects, the most common being bladder spasms. To help decrease the risk of bladder spasms, your doctor will co-prescribe a medication called oxybutynin. Oxybutynin works by helping the bladder muscle relax and help you to better retain the Adstiladrin therapy in your bladder during the course of that treatment. Oxybutynin will be taken 1 tablet per day for the 5 days before your Adstiladrin therapy. Your pharmacy will dispense this medication in a blister pack that looks like this. The medication is intended to be taken in the evenings, and your blister pack will be filled for the 5 days preceding your Adstiladrin therapy. So if you are due to have your therapy administered on May 7th, the blister packs that will be filled will include the second, the 3rd, the 4th, the 5th, and the 6th. You should ensure that you take your last dose of oxybutynin the night before your Adstiladrin therapy. Additionally, the administration instructions will be noted on the label, so you'll be able to find them on the label here. And if you have any questions about how to take this medication, you can reach out to Chartwell Pharmacy. Oxybutynin is a pretty well-tolerated medication. However, it does have some notable side effects, potentially constipation or drowsiness, but generally a very well-tolerated therapy. You will note that your oxybutynin will not look the same as what is described in this example, but you will receive product information that gives a description of what your oxybutynin should look like, and you should reference that material with it for any questions. There are a couple considerations to be aware of after the procedure. The therapy includes a non-infectious virus to help deliver the gene to the bladder. It is important to disinfect your urine after each void for the first 2 days of the procedure. Although this medication is considered to be non-infectious, patients who are immunocompromised may get sick from being exposed to the medication or being exposed to the urine from the patient. To do this, you will need to disinfect your urine with bleach. It's recommended that you purchase household bleach prior to your procedure so that you have it available in the home to follow the below recommendations. To disinfect your urine, you'll want to apply a half cup of bleach prior to voiding into the toilet, void, and then allow the urine and the bleach to sit for 15 minutes prior to flushing. You will want to do this for every void for the first 2 days after your Adstiladrin therapy. For any subsequent Adstiladrin administrations, you will also want to follow the same procedure. If possible, it is important for you to utilize a different bathroom than the rest of your household. Lastly, Bleach can pose health effects if not handled properly, so it'll be important for you to keep bleach away from any pets or children that might be in the house. If you have any questions, do not hesitate to call the pharmacy at 1-800-755-4704. Thank you.